it is time to introduce to you our new chairman. So it's my very great pleasure to introduce Heather Rohan. She serves as president of the HCA TriStar Division in Brentwood, Tennessee. She's had that role since 2016. But before that, she was CEO of TriStar Centennial Medical Center in Nashville from 2012 to 2016. She served as CEO of Ventura Hospital and Medical Center in Florida, probably wishing she was there today, although probably not. From 2005 to 2013, CEO of Palms West Hospital from 2000 to 2005. She has also served on the Board of Governors from 2015 to 2018, and was the regent for Florida Eastern from 2011 to 2012. In addition to all of her ACHE service and her day job, Heather serves on boards for the Tennessee Hospital Association and Barry University, as well as the United Way Board of Middle Tennessee, and, as if that were not enough, the HCA Foundation Board. So again, let's bring Heather up and give her a big round of welcome as our 2019-20 chairman.
Good morning, everyone. It may be -2 outside, but it's nice and warm inside today. And it's great to be with all of you. What remarkable leaders we've honored this morning. Again, I welcome you to the 62nd Congress. There are 4,000 of your colleagues, some that you know, some that you're going to meet while you're here this week. And we've got 175 educational sessions planned just for you. We have students here. Thank you for choosing healthcare. We have folks in every level of their career, early, mid, and senior careers. We've got something for you as well. We have members of our armed services here. Thank you for your service to our country and for being here today. I am honored to serve as your chair. I remember walking through those doors at my very first Congress, and I was in awe, frankly, of the people, the size, the energy that was in the room, and all of that there. ACHE has been a partner of mine for more than 25 years, and as I began my career, ACHE provided for me a network of colleagues and counsel and guidance for me in my career that created a network for me all throughout. ACHE has been a great partner for me in helping understand what the impact of and all the changes that we are facing in healthcare today, and continue to do that. ACHE exists because of and for all of you. Just as you plan to meet the future needs of your organizations by having a strategic plan, we do the same thing at ACHE in putting together a plan that will meet your needs in the future. Our strategic plan is predicated on our vision, and that is to be the preeminent professional society for leaders dedicated to improving health. The key tenets of our plan are these: to be a catalyst, to be a connector, and to be a trusted partner for improving healthcare. When we talk about being a catalyst, think about the Blueprint for Safety. The Blueprint for Safety was the result of a partnership and a collaboration between the IHI and ACHE. That Blueprint for Safety, I hope you've downloaded it. It's free, guys, it's free. You go on the website, you can download it, and it provides a way for you to assess your organization to see if it's safe, what are your strengths and what are your opportunities. The Blueprint for Safety, we also have a pledge. If you have the occasion to sign it while you're here, please do that, and we'll give you a pin that designates the fact that you are committed to improving patient safety within your facilities. We want to serve as a connector for you. As an association, the strength of our association happens right there at the grassroots within our chapters. We have 78 chapters across the country that are led by dedicated leaders, by yourself, in order to meet the needs of the members where they are in their particular areas. Listening to our chapters helps us become a better association. For example, when we heard feedback from our chapters about the fact that how can we facilitate face-to-face communication in areas that are a little bit more remote, we created an option to have that remotely done for face-to-face education across broad geographies. We will continue in the coming year to find ways to provide resources and tools for you to help strengthen the association at the chapter level. Our work in advancing diversity is very exciting as well. Our Dolan Executive Diversity Scholars, we met a couple of them last night at a reception. They are bright, energetic. They are the future of healthcare. And you help support that through our fund for educational scholarships. What's better than that? Finally, as a trusted partner, we want to be your indispensable leadership partner. We want to personalize your experience for you and meet you where you are within your career. We know that when you join ACHE, that first-year membership is so important, just as it is in your organizations. That first year, you're making a decision, is this really the value that I was looking for? Is this what I want for the future? So we're going to find ways to connect with you early on as you join us as a member so that you'll want to stay with us for 10, 20, 30 years after you join us. We've got an interest in advancing your career. Have you taken a look at Career Edge? This is another thing on our website. Career Edge has been put together, again, for wherever you are in your career. Whether you're an early careerist, mid, or senior careerist, we have tools, resources, jobs for you, so take a look at Career Edge. Part of what we're working on in 2019 is to help you even further in accelerating your career path to where you want to be and where you aspire to be. Yesterday, as Deborah mentioned, we had our convocation, and we had 175 members in person walk across the stage. And what was so neat about that, first of all, attaining your board certification is a very noteworthy achievement and really just fabulous. But what was really neat about that day is that I met a nephrologist, I met a surgeon, a trauma director, I met a CNO. There were individuals from every type of background in healthcare that you can imagine, and every stage of their career. So what that says is, again, no matter where you are in terms of attaining that certification, again, that's all there for you. And we encourage you to do that. In terms of being at Congress, here we are today, these 175 classes, and our themes, as you see, are innovation and growth, transformation, opportunity, and collaboration. It represents the best of what Congress has to offer. The team at ACHE has worked tirelessly to help put this together. It looks seamless, it looks invisible, like everything is running like a finely oiled machine, and that's because the staff and the team at ACHE have spent virtually thousands of hours to help make it look that way. So please join me in thanking them for what they've done. And so these 175 myriad of topics being taught by the finest faculty cover patient care delivery, innovation, collaboration, leadership, emergency preparedness, just about anything that you can imagine. So what if you returned home from Congress with just one idea on how to do something better in your organization, just one? Let's say that one idea was something that you could do to decrease surgical site infections in your hospital. So we know that the healthcare cost of a surgical site infection is about anywhere north of $20,000. First of all, if you were able to find one reason and one way to do something better, we have reduced the suffering of a patient, number one. We have helped reduce the cost of healthcare, number two. And your investment is there with one idea and one thing. And hopefully you'll find many more than just one idea, but one can be very valuable. In addition to that, what if you find a new colleague that you haven't known before to connect with? What if you find a colleague that you've known for years that you reconnect with that helps present you a new career opportunity? All of those possibilities are here for you today at Congress. As I stand before you today, it is with the guidance, support, counsel, and love of many that I'm here. I look at the past chairman officers that are sitting before you today, and I'm inspired by them. I'm inspired by the way that they have led their organizations. I'm inspired of how they have led ACHE and created the platform for which we are here today. I thank and credit Deborah Bowen, our CEO. Deborah has a vision, and Deborah, in terms of her leadership, she has a gift for looking into the future and finding out what we can do, again, to make sure that we remain relevant and important and pertinent to you as an organization. Deborah leads a team of dedicated and committed, Baldrige journeying leaders that are here and devoted and dedicated to do something better, to help you do something better for patients today and in the future. My fellow board members, what a dedicated group of individuals, leaders that they are. They are coming from all across the country. They come from all sizes of different health systems. and they bring their hearts and minds to the table every day in order to help us hopefully do the best that we can for you in turn. I have worked with HCA for 3 decades, and I have been afforded tremendous opportunities up to and including the one that I'm in today as a division president for TriStar Health. Our CEO, Sam Hazen, is a CEO that is still connected to the bedside. The support that is given to nurses, physicians, the whole care team with infrastructure, resources, tools, technology, and opportunities to grow is unprecedented. My boss, John Foster, a Hutchins Award winner, is someone who is incredibly supportive of me in anything and everything that I do. Every time I meet with John, I walk away learning something new from him. The TriStar division, the senior team I work with there, I marvel at them. They are so smart, so dedicated, so focused on doing things better for patients every day. Our CEOs in the TriStar hospitals, they've got huge agendas. They are covering service, quality, growth, and they do it with enthusiasm and passion every single day, as well as their teams do. So lucky am I and so fortunate. People ask me what my greatest achievements is or are. I'd say I have 2. Those are my sons, Joseph and Patrick. I'm here today with their wives, beautiful inside and out, Erica and Krista. I'm proud to be their mother every day. Then there's my husband, Joe Rohan. Joe's my best friend. Joe has been with me along the entire healthcare journey that I've been on over these years. And Joe, if I've got a question, Joe's got an answer. If I've got a problem, Joe's got a solution. If I need a shoulder, if I've got a worry, Joe's got a shoulder. And if I need a laugh, Joe's got a joke. So I'm incredibly grateful and thankful for you, Joe. Did I ever think that I'd be the chairman of ACHE and be able to achieve it when I walked through that room and looked at the front of the room and saw the people up there? I didn't think it, but did I dream it? I did dream it. I did dream it. Don't let what you think you can do stop you from what you dream you can do, because dreams do come true. Mine did. I am very humbled to serve in this role. So, right now, outside of those doors, a person is becoming a patient who will put their faith and trust in us to help them, to heal them, and for sure not to hurt them. And we will be able to, because there's never been a better time to be in healthcare than right now. We have technology, creativity, innovation. Couple that with caring and compassion, we can do amazing things for patients. We will do this because we can and because we must. Thank you so very much for choosing healthcare and healthcare leadership. Thank you for your attention. I hope you have a great Congress. Thank you.